Hello friends, welcome to my channel Urge to Learn. Today we are going to learn about cardiac function test. Introduction, why do we need these tests? The heart is a vital muscle that requires a constant supply of oxygen. When the heart muscle, known as the myocardium, is damaged, whether due to a heart attack, also called myocardial infarction, or extreme stress, the cardiac cells break open. This rupture releases specific enzymes and proteins into the bloodstream. By measuring these biomarkers in the lab, clinicians can accomplish three important goals. First, they can diagnose a heart attack, even if the ECG results are unclear. Second, they can estimate the total extent of heart damage. And third, they can monitor a patient's recovery progress over time. Classification of cardiac biomarkers. We can divide these tests into three main categories based on their clinical function. Category A, markers of myocardial necrosis or cell death. These are the primary tests used to diagnose an active heart attack. They include cardiac troponins I and T, which are considered the gold standard, creatine kinase MB or CK-MB, which is specifically useful for detecting a second heart attack shortly after the first, known as re-infarction, and myoglobin, an early marker that rises very quickly in the blood. Category B, markers of cardiac stress or heart failure. This includes B-type natriuretic peptide, or BNP, which is released when the heart chambers are stretched excessively due to fluid overload. Category C, markers of inflammation for risk assessment. This category includes high-sensitivity C-reactive protein, or hsCRP, which is used to predict the risk of future cardiovascular events. The gold standard, cardiac troponins. Troponins are proteins found within cardiac muscle fibers that regulate muscle contraction. They are the preferred choice because they are highly specific to the heart. While other enzymes might rise due to a leg injury, troponin I and T are almost exclusively found in heart tissue. Let's look at the clinical timeline. Troponins begin to rise 3 to 4 hours after the onset of chest pain. They peak at 12 to 24 hours. And they remain elevated for 7 to 10 days in the case of troponin Y, or up to 14 days for troponin T. The significance here is that because they stay elevated for so long, they are excellent for diagnosing heart attacks that occurred several days prior. Creatine kinase, MB before troponins, CK-MB, was the primary diagnostic test. Here's the clinical timeline. It begins to rise 4 to 6 hours after heart damage. It peaks at 24 hours, and it returns to normal within 48 to 72 hours. Now, here's the niche use. Because CK-MB returns to baseline quickly, it is the best marker for diagnosing re-infarction. If a patient has a second heart attack 3 days after the first, troponin levels will still be high from the initial event, but CK-MB will show a new, distinct spike. Myoglobin, the early bird. Myoglobin is a small heme protein found in all muscle tissue. The advantage? It is the earliest marker to rise, appearing within 1 to 3 hours. The disadvantage? It lacks specificity. Levels will rise due to a marathon or general muscle injury. But here's the value. It has a high negative predictive value. If myoglobin is not elevated within 4 hours of chest pain, a heart attack is very unlikely.